Hello, I am Dr. Desiree Nicole. My students call me Professor Sanders, but since you're not my student, you can call me Desiree. So I am here to just let you know that it was not all that easy for me as well. I had a situation when I was in my med-surg course, and I contemplated getting out of nursing school. I didn't do well on at least 2 exams. And I didn't know what was going on. Fundamentals was fairly easy for me because I was a nursing assistant. As soon as I got into med surg, I was like, what the heck? I don't know what's going on. I don't know how to answer these questions. So like I said in the previous video, that I had to go and talk to one of my nurse instructors, and she kind of broke down a handful of questions, not much. And it finally started to click. But now that I've been out of school for a while, I really have more of an understanding of these different types of NCLEX style questions. So if you want to know more, if you want to know how I look at NCLEX style questions now, stay tuned. Watch the video. It won't be too long. Trust me. Yes. It's like I talk for a living, so I'm not going to be talking long on YouTube. So stay tuned. Alrighty, so we're going to talk about Maslow. So Maslow has hierarchy of needs. He has them all acutely combined in a pyramid. Know that the beginning sections or beginning levels of the pyramid are your priority. So that would be your physical, then your safety. So physical has more to do with like food and water, those basic needs that we have for survival. And then you move on to safety. So to give you an example of a test question that I have had, the patient comes in, younger patient has lacerations on their wrists. So when they were at home, they tried to hurt themselves. I'm not sure if the question says that they were trying to commit suicide, but you can say either or they were trying to hurt themselves or they were trying to end their life. So the answers include these interventions. Two of them I recall that students go back and forth between. Do you further assess for suicidal ideation? Or you can say, are you going to complete a suicide assessment? Or are you going to establish vital signs based on the fact that the patient has lacerations? The answer, students argue with me all the time, the answer would be to establish vital signs. You're going to establish vital signs because you don't know what's actually going on. They could have actually cut something and they could be bleeding. We don't know. You're going to establish vital signs before you assess for suicide. And a lot of patients, they don't do much damage when they hurt themselves, but you don't know. So that's why you have to address those physical needs first. So please take a moment, just review at least those lower levels on the Maslow hierarchy of needs. It will help you tremendously on exam. Invasive versus non-invasive. So if you have a test question where they're giving you options and some of your options have to do with doing a procedure or intervention that's invasive versus some that are non-invasive, most likely is going to be that option that's non-invasive that's going to be the answer. They want to see more so what would you do as the nurse. So as the nurse, we do things that are non-invasive. If you're going for registered nurse, LPN, those are going to be interventions that are non-invasive, such as focusing on safety, such as educating your patient, such as assessing your patient, encouraging your patient. So you might look at the scenario and think, oh, that's not going to help the patient. That is not what the patient needs. So don't think of it like that. Don't think of you needing to fix every single thing that's wrong with the patient in that particular scenario. Most of the time, they just want to know what is your first thing you're going to do? What is your priority, right? So they want to know what could you do as the nurse? They want to know about your skills. So typically those are going to be non-invasive types of interventions that you can perform as the nurse. Opinions versus facts. Surprisingly, no one wants to hear your opinion. And I hate to say it like that, but the nurse's opinion is their opinion. So some examples saying that everything is going to be okay, to be honest with you, that's your opinion. To say that, such and such, your loved one is going to be just fine. That's your opinion. You want to make sure that your information is extremely factual. So, for example, I see a lot of questions that relate back to patient education or family education. If someone asks you about a disease process or medication, you want to pretty much state what's in your textbook. You want to give factual information and leave your opinion out of it. So if you see something that says, like the nurse says, I think this is what it is, or well, it happened to me. I had breast cancer before. Those are incorrect. Trust me. Even if they sound like they are comforting to the patient, you want to make sure that you choose the one that's factual. This is, this is what's in my textbook. This is from the resources that I received from my instructor, or, I read this on the CDC or NIH. You want to stick to factual information to answer these questions. Patient needs versus nursing needs. It's always about the patient. So think about it, patient-centered care. Patient-centered care revolves around the patient goals. So whatever their goals are, patient will ambulate 200 feet by day 3. Also, all of your planning goes with their goals. So it's always about them. That's why we do nursing diagnosing. That's why we identify patient problems. So you want to make sure it's about the patient needs, not the nursing needs. Give you a classic example. I had a test question about a patient being suicidal, right? So it said something like, your one of the answers, which was the correct answer, was to remain with the patient throughout the shift or something like that. So many students was like, yeah, that's not realistic. The nurse won't be able to stay there with them. So you can't think of these answers that way. You can't look at it as, oh, the nurse won't be able to sit there. How do you know? You don't know. It could be where you talk to the supervisor and they consider this patient to be an extremely high risk suicide. So you might have that patient. I've been on psych floors many times, especially with pediatrics. I see the nurse sitting outside the patient's room the entire shift. So don't make assumptions that this is not possible. You need to think about what is the patient's need at the time and focus on their needs. Not so much, okay, well, the nurse needs to do this or the nurse needs to do that. So take that out of the picture. That's not even a factor in this equation. So urgent versus emergent. Commonly, I think about urgent as would be like your rapid responses, what we call it around here. Emergent would be more like your code blue. So to me, those are two totally different types of responses. So urgent, or you can look at it, okay, as urgent as being more so like an urgent center, what you would go to urgent care for, versus, if something's going on with you where you have to see a physician, NP or PA right away, you're going to go to the emergency room. So with test questions, read the scenario. In many cases, it's more so an urgent type of situation, many times. Because emergent, when I think code blue, I think about a patient's going to lose their life or they're going to lose a limb. They're going to lose something that's irreversible. That's when I think about we need to call it code blue, because we need everybody in this room right now. Most of your test questions will not be in that type of area unless you are in like a critical care course. That's a possibility. But in the vast majority of your questions, when we talk fundamentals, med surg, OB peds, psych, it's going to be more so these are some possible urgent situations. So with urgent situations, they still want to know, what would you do first? As that registered nurse, as the LPN, what would you do first? And then, of course, later on, which could be literally 2 minutes from now, you can consider what the provider could possibly do. But with these test questions, they want to know, what would the nurse do? What will be your intervention? So I look at it as more so, okay, this is more of an urgent type of situation. I can do something. I can even, in many situations, even if I'm assessing vital signs, even if I just stay with the patient. So like I've had questions where the patient has severe anxiety. So it could be, this is more so urgent because the patient needs to sit down, they need to take some deep breaths in and out. So more so, what would you do in this situation? So typically I have seen where it is to you are to notify the physician. Typically, those questions are more so urgent, and those answers are incorrect in most cases that I've seen. If it says to notify the physician, in most cases I've seen that they're incorrect, because in many, if not all, but many situations, you're going to do something first. You're going to do something before you go ahead and contact the provider. So in most cases, if it says what would be the nurse's initial response, it's going to be something before. Like it could be one step before calling the provider. It could be 2 steps, whatever. You're going to do something before you go into contacting them, because as many times you can do something, even if it's assessing the patient. You can do something before you contact the provider. So that's kind of what I wanted to review. I definitely have some more key points that I can make more videos about. I am just trying to help you get through nursing school, answer some of these test questions as simply as possible, not to make them more complicated, not to give you more stress. You got this, you can do this. It is to me, is all about practice. You practice doing these questions. You practice just in regards to timing, in regards to, can I identify keywords? Can I identify exactly what the question is asking me? This is how you practice. You practice these questions, and then once you are in a classroom, you'll be like, oh, this is nothing. I got at least 90% of them. I might not be so sure about 1 or 2 of them, but I got the rest of them, so I'm feeling good. So I was just about to say good luck, but I don't believe in luck. I believe in preparation. So I'm here for you. If you have any suggestions about any other videos, I will definitely look into it and make a video for you. Have a good day.